Okay, so we're going to be strapping the knee today. This is good for the MCL, good for the ACL, and just all around good stability for any sort of major ligament issues. We want the knee a little bit bent, so we're going to put one of these little leftover bits of tape under her heel. Thank you, Mole. We can't show you her face because she's so famous. And that gets our knee in a good position. I've got it up on my treatment table, so that's good for me, good height. If you can do that, that's particularly good if you're doing a lot of them. We're going to put a bit of Hyperfix around her for the anchors. Tends to make it last a bit longer. Not super necessary. If you were strapping just before a game, that would be fine. But if you're strapping and you want to leave it on for a few days, I'd highly recommend you put the Hyperfix on. Particularly if you suspect somebody has got sensitive skin. And of course, always warn them that if it makes the pain worse, or if they feel any kind of burning, or any kind of soreness with it, to take it off immediately. And we'll do an anchor up there as well. And make sure you give them that warning, because some people can actually get a burn from the chemicals in the tape. My record is a young lady who started to show signs within 20 minutes. So, and of course, as luck would have it, she was the daughter of a good friend that's on the way. Now, if your model is a little bit worried about being so high, usually your roof is going to be low enough that they can hang on, which our fantastic model is doing here today. How you doing at the model? Doing all right? Yeah. We're really not paying you enough, are we? Okay, so I'm going to Hyperfix the whole thing. To cover the skin, just to protect the skin of our model. But if you, as I say, if you're doing this just half an hour before a game and you know their skin doesn't get irritated, then you'll be fine. So that white stuff I'm using there is Hyperfix. You can use any width. I tend to use the 10 centimetre just because I can get it on quicker. And there's less mucking about. You'll see a lot of people use the 5 centimetre width, and that's fine too. Okay, here's our knee. So we've got these as anchors, and you could use them as anchors, but we're going to put additional anchors on because she's playing a high impact sport. So we're putting that around there. Sorry, champion. Bringing that through. And you notice we're putting it on at a slight angle, so we're sort of following the contours of the thigh a little bit. And that way we're less likely to cause tightness and problems, particularly with such a muscular model. She's going to hit me later. Don't stop recording. I'm going to be the victim of getting bashed. This calf one, not so much important on that, at that level. And just make sure you take the tape off the roll before you put it on. Okay, that way you won't put it on too tight. People that are yanking on the roll and pulling on the skin, it's not comfortable, and there's a good chance you will hurt them. Okay, we're going to go on the inside here. So, starting up on that inside edge, and then we're going to overlap by about 50%. And again, I'm not putting the tape on tightly, I'm just placing it in the right location, and I sort of iron it on so it gets a nice good stick onto the skin. So we've got 3 there, and you can vary the number of those depending on the size of the person's legs. If you've got some big monster rugby front rower, you might have to do 4 or 5. But those 3 cover this leg fine. Then we do a little bit of an X, so like that. I just tend to do 1 X, but again, if you're dealing with a high impact sport or somebody who is a big athlete, you might need to do several of those. And the middle of that X should go right through the center of the joint and be roughly level with the center of the joint. So it's all working on that axis. Right? Now the kneecap sits a little bit high on the joint, so that center of that X should be roughly towards the bottom corner of the kneecap. And we do exactly the same thing on the other side. So we do 3 overlapping. Patient the whole time keeps their knees slightly bent, doing a good job. And then we do our X, like so. And then we finish off with our anchors top and bottom. So again, a bit of an angle. Again, pulling it off the roll before we stick it down. So try not to, I'll do a bad one. Try not to do this where you wrap it around and then you're pulling it on the thing and you're doing this, okay? Take it off the roll and then place it on. It's a better way to do it. Anchors down the bottom. Pulling it off the roll and then just tucking in the roll. Pulling it off the roll. Around. And if we do it right, it should almost be like a little bit like a diamond if you're looking at the brown tape there. So we should have a point at the bottom, point at the top, and they should pretty much go straight through the kneecap. And then the edges, the centers of our X's pretty much go through just towards the bottom of the kneecap. And voila, that's our stability knee tape.